an absolutely fantastic place to be right now.
I'm quite excited about what we've done all this week thus far.
I think staff have really embraced this.
A lot of enthusiasm.
There's a fantastic buzz about the place.
The patients are flowing through the department a lot faster.
It's had a massive impact.
I've absolutely seen some improvements.
I think the surprise is how quickly patients have moved through the department.
The whole place is calmer.
We're in A&E here, it's 12:30.
It's 4 o'clock on the Wednesday afternoon.
It's 11:45.
It's 2 o'clock in the emergency department. So far everything's going well.
It's Friday, it's 12:05 and we're on day 5 of Perfect Week.
It's just after lunch of day 5.
Well, it's day 5 and Perfect Week.
We're 5 days into Perfect Week and it's going really well. Everybody's still really enthusiastic.
What Perfect Week's about is really focusing on our hospital for over an 8-day period to find out how we can get patients to the most appropriate place as quickly as possible.
We are definitely seeing improvements, so we've got more empty beds than we would normally expect to see, and what people are saying is it's a really quiet week because it feels quiet, but actually we're seeing as many patients that we would see on a really busy week.
We have had patients coming and going all morning, so we've had discharges. We're avoiding delays in terms of making sure that patients are getting the right blood tests at the right time, that they are getting the right scans at the right time, and then hopefully we can either move them back to their home environment or we'll be able to move them down the wards to another appropriate environment within the hospital.
Because we've put some ward liaison officers on, the ward staff feel like we've given more nurses, when in actual fact it's the same number of nurses freed up that can spend more time with patients.
My role usually here is IT training, but this week I'm the ward liaison officer, which involves me escalating any delay issues on the wards, supporting the nursing staff in getting any diagnostic tests chased up so that we can have information at hand. I feel that the patients have benefited from this. They are quite impatient sometimes and they do want to get home, obviously, from the wards, so this whole process has helped that happen.
Perfect Week is about looking at patient pathways. When a patient's admitted into hospital, their length of stay is determined by a whole series of different professional groups and different agencies actually, so nurses, doctors, therapists, diagnostic procedures and maybe even social services. And often the length of stay of a patient is determined by who's the slowest. And what Perfect Week is about is identifying every patient in the hospital on a regular basis to find out what is delaying their discharge away from hospital.
So I'm Silver Commander for today. My role today is to try and manage the operational difficulties that are one above the daily operational difficulties. So everything that people can't sort out today are being pushed through this room, and my colleagues and myself are trying to manage those with me managing a group of senior managers today in the organisation.
I've only had to escalate one problem to bronze today and it was sorted within seconds.
We call it Perfect Week and of course everything's not perfect, but for patients not to be delayed at every step of their pathway is really important and it makes a big difference to patients.
The impact has been phenomenal in terms of patients being able to be seen quickly by all the departments, whether that's an X-ray, whether or not that's a CT of their head.
I think the impact for the patients is they're not having to wait so much as they might sometimes do for social care provision, for discharge and for access to certain services they want, because we're quite deliberately trying to pick up delays and deal with them.
This is actually making sure that there are no delays in the system and that patients, once they're told to go home, they're home very quickly. And then we've got that bed ready for another patient that is an emergency patient and needs that facility.
The absolute value of everybody being together, working to the same plan, what we've achieved, what they've achieved has been outstanding and benefiting patients at every level. That for me has been better than I ever even dreamed of.